There are things that hello everyone. Welcome back to Times of Profession. I'm your host, Tony Akonle. I hope you're doing great. I hope you're keeping safe. I'm glad you can join me on the second part of this series on autism spectrum disorder. And like we saw the last time, this month is the month of autism awareness and autism acceptance. So today we want to talk about some of the signs we need to look for so that we can know if our loved one is on the spectrum, so that you can speak to your child's pediatrician or doctor and get a better feel of what is going on with that child. So last week we talked about two things. We talked about not responding. A child that does not respond to their names at times might be a sign that that child is on the spectrum. A child that has difficulty in responding back to you might be on the spectrum. That is when you begin to notice speech delay in your child that should be at the age of speaking. Like I said before, every child has their different developmental levels, but there's a yardstick to measure if a child is on the level where he or she is supposed to be developmentally. And those who can do that for us are the children's pediatricians or doctors. So what are some of the other things that we can look for on the spectrum? Like I said in the first part of this broadcast, because the symptoms vary, that's why it's called a spectrum. It's a wide variety of symptoms. So a child can exhibit some of the symptoms and not exhibit some of the symptoms. But there are children that I have come across that exhibited a lot of the symptoms, so that it is quite easy to know that this child must have something going on with him or her, and being able to tell the parent, to recommend rather to the parent what they could do. Now, the next thing I want to talk about is fixation. So many times, children on the spectrum or people on the spectrum get fixated to a particular thing. I have seen children fixated maybe on a painting on the wall, and they stay there and stare for minutes until you gently divert their attention for what they are doing. Some children have fixation on toys. They want to play with the same toys all the time, or they want to play with that toy in a particular way all the time. I've seen children who will line up toys in particular ways, the same set of toys every time they are playing, when it's recess time or it's just playtime. These can be signs that the child is on the spectrum. Some children have fixation on food. It could just be a particular kind of food, and that's what they want to eat morning, day, and night. This might be a sign that the child is on the spectrum, and this might not mean anything. Now, I've seen children who likes to sleep with particular blankets, covers, who likes to sleep with particular toys. No, I'm not saying that that is a fixation that is related to autism spectrum disorder. But if you see anything at all that bothers you, then please don't keep it to yourself. Seek help, because like I said, early intervention matters a lot. Also, when a child does what you call echolala might be just repeating a particular set of words or saying words that does not make sense to the other people around them. But let me say here, that echolala has a meaning and has a function. So the child that is on the spectrum saying those words, you might not understand it, but they know that they are communicating about something. So if you continue to see that pattern in a child or in somebody, it might be that a person is on the spectrum. And there are some children, they repeat verbatim what you have said. Because they repeat what the parents or anybody has said verbatim, makes some people not understand that that is a symptom for somebody on the spectrum. Because what you have to realize is that the child is receiving the word but not responding to the word. So if your child, if you say, how are you? And your child says, how are you back to you all the time. And the child is supposed to be able to say, fine, thank you, or great, thank you. But the child keeps saying what you say. You say, are you okay? The child says, are you okay? If you see that pattern, then you need to talk to your pediatrician just to find out what is happening. There's another symptom, the flapping of the hand. Children flap their hands because the child is trying to communicate something. There might be an overload of stimulation. Maybe a bright light just suddenly comes up or very loud music comes up. The child is trying to cope with this overstimulation, and in so doing, the child is flapping the hand. Or some children will cover their ears with both hands because they are trying to keep out all those stimulus that is coming to them that is too much. It's called overload of stimuli. So we need to watch out for that. In another broadcast, I'll be talking about how loud noise, bright environments, clutters, and things like that, actually affect children on the spectrum, how they respond to it. So when children flaps their hand, please don't look at it that it's just an habit. It's just an habit. That child is trying to catch your attention, to let you know something is going on, especially when they cannot express themselves with their speech, with talking. And that's one of the things, the beauty of working with children on the spectrum. When you relate with children on the spectrum, you begin to understand when they do this. You're able to isolate the situation. You're able to find out what is happening. And before you know it, you are able to prevent that situation before it happens, so that you will be able to limit or take out the responses to it, like flapping of the hand and stuff like that. The last one I want to talk about today, which is not the least, is walking on tiptoes. At times, children likes to copy others. So you can see a child just walking on their tiptoes. And children, they are sponges. If they watch something on the TV and somebody's walking on tiptoes, they will do it. But when you continue to see your child walk on tiptoes, it might be a symptom of the child being on autism spectrum disorder. We had a child who would not sit crisscross for circle time, and the teacher will complain that this child does not sit, this child gets up, this child just turns. And I decided to find out what was happening. So I went to look this up, and because there have been some other symptoms that we have seen in this child, I decided to read it up. And I found out that it's because there's a tense muscles in, like, around the labs of some children that are on the spectrum. So sitting in particular position might not be comfortable for them. And so that made me understand that many times when children walk on tiptoes and they continue to do it constantly, it is because they're on the spectrum, and there's a reason for it. There's a function for it, because of the tightness in the hip muscles. So with that, I will stop here, but just quickly punch the points I talked about. We talked about speech, we talked about responses, we talked about focus, fixation, we talked about echolalia, we talked about repeating what has been said to them. We talked about walking on tiptoes and flapping of hands. If you do see these symptoms in any of your loved ones, don't panic. Talk to their doctor. They can actually get the help needed to tackle every one of these challenging situations. But early intervention is key when it comes to little children. Once again, I want to say thank you for staying tuned. I'm your host once again, Tonya Akonle. Please remember to like, share, remember to comment. And until next time on Times of Refreshing, have a wonderful time. Bye-bye.